Welcome to the New England Journal of Medicine at the annual meeting of the European Society for Medical Oncology. I'm Stephen Morrissey, managing editor, and I'm talking with Eric Rubin, editor-in-chief, and Oladapo Yeku, associate editor of NEJM Evidence. We're looking at the Spotlight and GLOW studies, Zolbetuximab in gastric or gastroesophageal junction adenocarcinoma. Yeku, what's the mechanism of this newer agent, Zolbetuximab?
So Zolbetuximab is a monoclonal antibody that binds to Claudin 18.2 and causes antibody-dependent cellular cytotoxicity and complement-dependent cytotoxicity. Claudin 18.2 has restricted expression on normal gastric mucosa, and malignant transformation by gastric and gastroesophageal adenocarcinoma causes loss of polarity of this antigen and potentially makes it more susceptible to Zolbetuximab.
This is a later follow-up of two studies, each of which compared two different chemotherapy regimens with or without added Zolbetuximab. Eric, what did these studies show and what do we learn now?
Steve, the original trials were two separate trials in patients with HER2-negative unresectable gastric or gastroesophageal junction cancer, and they used different background regimens, but each showed about a 2-month increase in progression-free survival with added Zolbetuximab. Overall survival was also increased during the short-term follow-up. Here we have the combined longer-term data. Overall survival increased from 13.7 months to 16.4 months with the addition of Zolbetuximab. Progression-free survival also increased by about a month.
Yeku, while these differences are modest, do they point a way toward additional studies that might further increase survival?
Yes, it does, Steve. This therapy is for a biomarker-defined population, that is, patients with Claudin 18.2 positive, HER2 negative disease. This data now sets the stage for adding or refining therapy for this biomarker-defined population, including in the adjuvant or maintenance treatment setting.
Since this drug induces cytotoxic immune responses, if it were combined with checkpoint inhibitors, might you see improved outcomes?
Eric, this is a very reasonable hypothesis to test. Generally speaking, treatments that engage both the innate and adaptive arms of the immune response are more likely to result in durable responses in solid tumors, such as gastric cancer. Combination of drugs like Zolbetuximab, which induces antibody-dependent cellular cytotoxicity and complement-mediated cytotoxicity, combining these with immune checkpoint inhibitors that predominantly engage cytotoxic T cells and the adaptive immune response might lead to promising results for this population of patients.
Thank you, Yeku. Thank you, Eric. The report of this study is now available at nejm.org.